Thank you everyone for coming here today. My name is Johnathan Pathmanathan, and I'm a recreation therapist. I've been in the field for quite a few years now, and just a brief introduction about myself before we get started, because you may want to know who's going to be talking to you for the next hour. Who is this guy, right? But like I said, I'm a recreation therapist. I've worked in pretty much every stream of therapeutic recreation that you can imagine, both in private sector, public sector, doing volunteer work in mental health, developmental health, working with seniors, working in the community. Like the potential and the reach for this profession is honestly limitless. And this is something that like a lot of people don't really know. And the reason for that is because therapeutic recreation is the newest, the most emerging in allied health professionals. So typically on an interprofessional team, because we are a healthcare provider, basically you would have a lot of people like occupational therapists, doctors, nurses, psychiatrists, peer support workers, personal support workers. And so we're just coming into the mix as of late. And although the profession has existed for a few decades now, when we take the whole context of healthcare into account, we're fairly new. And there's a lot of advocacy that's still happening for this field. But let me tell you what's so amazing about therapeutic recreation is that we take therapy outside of a formal setting and make it happen in a person's environment, in their world. And that's what's so unique about what we do. And a lot of people, they don't recognize that. And it's up to us as the practitioners to show how the profession and the understanding of the modalities and our therapeutic skills can be used in a way to not only provide people with care, but enhance any team that we go to. All right, so let's just quickly talk about what therapeutic recreation is. I'm just going to read off the slide for a quick second and then we'll come back. Therapeutic recreation is a process that utilizes functional intervention, leisure education, and recreation participation to enable people with physical, cognitive, emotional, or social limitations, but not excluded to those as limitations, to acquire or maintain the skills, knowledge, and behaviors that will allow them to enjoy a greater quality of life. So what is a take home here? Right, we do three things for the most part, right? Generalizing, and I'll get into what we do a little bit more in the later slides, but functional interventions, leisure education, and recreation participation are the three main tenets of the model that we operate under. We operate under a model called the leisure ability model. It's person-centered, it's strength-based, it's holistic. So these are all the kinds of things that people want to hear. At the end of the day, we're practitioners and we're providing a service. So when we are providing a service, who are we providing it to? Right? It could be a customer, it could be a patient, it's somebody else, right? So when we're providing a service to someone else, we want to make sure that it's relevant to them. And nowadays, with healthcare transforming away from a deficit model where we look at the things that people are coming to seek support with as problems towards a strength-based approach, we're using people's strengths to support them in navigating these challenges rather than just defining a person for their limitations. An example of this would be, let's say, oh, so-and-so is autistic, and so you put the diagnosis before the person, and it takes away the opportunity to understand who the person is and how we can reflect their personality, their strengths, their needs, the specific accommodations they may need in their care. All right, so we do those three main things. We work to support people that have limitations, but when we take our practice outside of healthcare, in the public sector, and we go into the private sector, we can most certainly use this to enhance a person's quality of life in general. Meaning someone doesn't need to have a limitation in order to benefit from our services. So the goal of recreation therapy. The goal of therapeutic recreation is to build a positive spiral of emotion and action in clients that energizes and empowers them to take on increasingly greater opportunities and challenges in important, valued life domains successfully, further strengthening their positive beliefs emotions, and capacities. All right, so this is straight from the textbook. All right, the actual goal of what it is that we're trying to do, and it's common between all textbooks. So like, there's no room for discussion. What we are here for is to strengthen people's self-perception, their self-concept. When people are done working with us, they leave a better person in general. All right, they're energized and they're empowered because we're showing them what the potential um, benefits of engaging in leisure that's relevant to them can do for you, really. I mean, think about it, right? If someone comes to you with a problem like social anxiety, and their desire is to really engage with their communities, step out of their shell, they just don't know how. They need more confidence, they need more autonomy. You can develop an intervention, or you can find the right resources to support them in overcoming their social anxiety through meaningful therapeutic engagement, such as improv, for example. And then you would go and reach out to someone in the community that offers these types of programs, and you go in as a therapist and support the individual from start to finish, helping them engage in the experience, reflect on the experience, so that you can reinforce it and support them in ensuring that they come back and continue to receive those benefits. So, because we know that a lot of times we have things like motivation, we have things like action, and people used to think that motivation was required to do. Actually, this was the mindset for almost 100 years. You do, and then you get motivated is the reality. So we got to act first, experience the benefits, be open to them, and then we're able to continue to get motivated. And so this is important because in the definition of the goal of therapeutic recreation, what we're doing is we're empowering people to take on increasingly greater opportunities. So it's all progressive, right? And we recognize that things don't just flick on like a switch. It takes time. And so we do a little, we step back, we assess, we reevaluate, and then we try to re-implement. And it's a working progress, right? We're working with people, and it's a qualitative service. We're not just trying to go through one person to the next person to the next person. And this is what we also advocate for: quality of service over anything else. Remember, working in healthcare, working in the health industry, you're often fighting the perception that someone else may have left with an individual, meaning that that person may have received very poor care from someone else, and their perception of care and your ability to support them may be skewed based on that. This is our opportunity to negate that and maybe um, refocus their perception on more positive things about what we can do for them being a support service. So, why use rec therapy services anyways? We operate under two assumptions. The first assumption is that every human needs, wants, and deserves leisure. Does anyone disagree with that? Do you just want to work all the time? The second is that most individuals experience barriers to satisfying leisure. Barriers could be, maybe you don't have an arm and you want to row. Maybe that was something that you did in the past. You lost your arm in some sort of accident and you want to find a way to get back to that, but now there's a barrier. That's where we come in. Maybe it's that social anxiety example that I used earlier. Maybe it's that you're a busy mom, single mom of 3 kids. Maybe it's that you work 2 jobs. Maybe it's you're so consumed into what you're doing right now that you can't possibly see other perspectives. Regardless of what the barrier is, we come up with proactive solutions for these challenges. And so we're here to show people um, what types of leisure they may be interested in if they don't have the appropriate leisure awareness. And leisure awareness is a whole topic of its own that we cover in later lectures. The second thing is we work to support people in removing barriers so that when we're no longer with them and supporting them, we're able to continue to engage in these activities that we know are going to be therapeutic for them and provide them an outlet for their stress, for self-expression, and many other facets of the self. Where do RTs work? Well, like I said, the potential for our spread is limitless. So as long as there's people, we can work with them. This could be in health clinics, hospitals, rehabilitation centers, mental health centers. family service centers, correctional facilities, schools, camps, the list goes on and on. Just to give you some examples, I work at a mental health hospital full time. I work at a senior center part time. I work in the community part time. And so a lot of these things are just different avenues for what we can do. And if you're wondering why does this guy work so much, I really enjoy what I do. And this is not for me to sell you or anything like that. The reality is that you're really supporting people in a fun way. This job doesn't always have to be serious. And although from outside looking in, it could be like, oh, all you guys are doing is taking people on hikes, taking them through art activities or exercising. Think about this. We're training ourselves to look in a certain way that other people aren't able to. Or someone might see you as just hiking, or someone might see you as just coloring or gardening. We're recognizing the therapeutic skills that are going to support you in actualizing those outcomes that you've been hoping for and wanting to for so long. That's what we're supporting an individual in doing. We work to look at potential because we believe in the capacity for transformation. And a lot of times, the people that we're working with are coming from socioeconomic backgrounds where they haven't been around an environment that is nurturing of their needs, right? When working in a mental health hospital, for example, people are coming with a lot of disparities, such as lack of social supports, lack of awareness or accessibility to the things that they need. And so they may need someone to instill a sense of hope in them, to show them how to connect with community, how to find purpose in order to achieve recovery. So it's really a beautiful thing that you're doing. You're showing someone how to look at the world because these people don't always have the opportunity. And whether it's, being in the hospital, you just broke your leg and you're feeling very down, you're an active person, you lost your sense of identity by not being able to engage in what you like, whether you're an adult who's been working all the time because you've had to prioritize your family and your family's needs and you always put yourself second or last. We're teaching people how to prioritize themselves, how to put themselves first, and how to get all these things out of even just a simple activity. And the reality is that in 24 hours in a day, we work for so much, and the rest of the time, we're using just to maintain our lives, that it's not about having so many things. It may be useful to be aware of all the different things out there, but even just engaging in one thing as a therapeutic outlet for yourself and recognizing that that's an opportunity for self-expression and a way to have a part of yourself come out for people to recognize and see what you're capable of, that's valuable because the last thing you want to do is leave life, leave this earth, not knowing who you are. So who do we work with? We work with a lot of different people. We work with doctors, psychiatrists, PSWs, personal support workers, DSWs, nurses, OTs, behavioral therapies, social workers, speech language pathologists. There's so many. And what this means is it gives us a great opportunity to collaborate and enhance our service delivery through the lens of all these other people. And we teach you how to do that in this course. So that when you go in to an interprofessional team, you're not there just kind of like twiddling your thumbs wondering where you fit. You know. And the reality is that a lot of people without that insight of how to work with other people, not necessarily interpersonal skills, but interprofessionally, it can really it can put a it can really stop the momentum that you can have as an allied health professional. And so we make sure that we reinforce these skills in you so that you go into your job feeling confident. So who do we support? We support everyone really. We support children at risk, adults, seniors, people with various disabilities or limitations, whether they're physical, social, mental, cognitive, emotional, behavioral, all the domains, right, of what health and wellness are, we support, we enhance. And we also support people that are recovering from severe injuries, wanting to incorporate leisure into their lives, or looking to find balance and achieve holistic wellness. Just really quick, for those that may not know, wellness is multifaceted. We recognize that there's so many different avenues that can contribute to overall wellness. And so we really want to pay attention to that, right? Some of these things are the physical, the social, the occupational, the mental. There's so many, and these are interdependent. And so we recognize that you can be physically healthy, but still unwell, or mentally strong, but because you didn't give your body that much time and care and love, that you're still unwell despite having a great job and having a great social life and all those other things. So we look to enhance everything and bring it all up. You're only as strong as your weakest link, right? So the role of the recreation therapist, this is really interesting because earlier I explained to you what the model that we practice from is, the leisure ability model, and how we do functional interventions, leisure education, and recreation participation. And these are all very important, but we can further hash it out into what you see here. Starting at the very top, we design, implement, and evaluate programs. Designing these programs means that we have to consider the population that we're working with, the challenges that we may come across while working with them, um, and how well we can implement it in a way that's meaningful and therapeutic, right? If there's too many gaps, we can't experience that flow, then the individual also won't experience that flow. And so then we're not getting the outcomes that we want as facilitators of groups, or for the individual that's giving us their time, right? We want to be proficient because in the service industry, when people are coming to us, they're giving us their time. And we have to value their time the way that they value it, not the way that we value our time, right? So being proficient in these skills are very important. So in designing and implementing, but also in evaluating, right? We don't just want to create something, say, all right, let's try it out, and then that's it. We want to go back and reflect and see what worked, what didn't work, what could be improved. And this is not just from our own lens. This is from the lens of the interprofessional teams that we work with, as well as the clients that we're supporting. We want to ask them, what did you like? Would you want to do this again? What would you like to see differently? Knowing that it's not personal. At the end of the day, it's for that person, not for us. It's not a reflection of how good our groups are, as long as we're looking to go back and evaluate and make the necessary changes. The next thing is we do assessments. We do things like leisure interest assessments, leisure awareness assessments, suicide risk assessments, leisure competency measures, where and we'll definitely go into a lot more of these later, but just a brief overview. We do a lot of different assessments. And typically with assessments, we get insight and understanding into the people that we're working with. So we teach you how to do or conduct assessments in a way that elicits the information that you need, so that you can organize it and use that to support you in the design, as well as the evaluation of the programs that you're running. A huge part of what we do going down is facilitating and reinforcing the leisure experience, right? So we do something with an individual after designing it. So this is the implementation part where we facilitate. And when we're facilitating, we're supporting a person in engaging. So imagine like if you have it, I don't know if you, Lindsay, maybe I'm gonna pick on you for a sec. If you have a child or a sibling or anything like that, like it's just someone that you were like maybe mentoring and teaching something new to. You want to support them in focusing on, and if you don't, it's fine. I'll explain where I'm going with the example. You want to support them in recognizing all the good that can potentially come out of something. So let's say, like I'll use myself as an example. I have a younger brother, 8 years younger than me. And so growing up, obviously, like I had the opportunity to show him a lot of things. Also, I didn't show him a lot of things because he's a younger brother and I don't want him following me around to all the places I go with my friends. But you take him out to the park and you want him to like learn some positive outlets for leisure expression. So you're taking him to go play soccer. And then when soccer is done, you're like, wasn't that exciting? Wasn't that thrilling? Passing the ball, communicating with people, being out in the yard, the sun beating down on you, like the competitive nature of it all, winning a trophy, like all those things, orange slices on the sidelines, like all that stuff, right? And you could blindly go through these types of activities and just go, oh, that was fun. Or you can bring attention to all the great things that you can experience from something so that you can look forward to continuing to experience them. And that's how we reinforce something, right? And so we teach you how to break down an activity into each of the facets and the individual benefits so that people will maybe find the ones that appeal to them and focus on those. Because not everyone is privy to all the benefits, right? Like you may not care about the orange slices, but you may care about being out around people and being in a competitive environment and getting to exercise and feel that serotonin surging through your body and you know, all that stuff. So we recognize that by explaining all the things, people can then focus on the few that they like and continue to do that. And that models behavior for other activities, right? So it's all transferable. If you're able to recognize those types of things in one environment, you could then go swimming and pick up all those other things. Oh, that water was refreshing. Or you could go hiking and be like, look at all the different colors of the leaves and the sounds of the animals in the ravine, that kind of stuff. Moving on to goal planning. This is huge because the reason we want to work with other people is to support them in developing something to work towards and achieving those outcomes. So if those outcomes are things like improve physical health or managing your mental health by having a wellness tool, um, that's going to be something that we can work towards actively. And in goal planning, we teach you something called the SMART goal format, right? SMART is an acronym for specific, measurable, attainable, relevant, time bound, so that you can really put the onus on the individual in a way that's encouraging. It's not like I'm pushing all this stuff on you. Be as specific as possible. Oh, I'm going to go to the gym 3 times a week for 60 minutes on Monday, Monday, Wednesday, Friday. But we're giving them a way to be accountable to themselves. And by sharing in that goal planning, we can support them. And that's all we're doing, right? At the end of the day, we support the person. Lastly, we facilitate groups and one-to-one. As a recreation therapist, you're going to work in groups. You may be working in groups of up to 30 people, right? And you're going to be conducting different types of leisure experiences, whether that's nature appreciation, whether that's smudging in the park, whether that's a sit-down conversation group. Um, and you can take these groups and apply that same sort of protocol towards a one-to-one, where you work with people that need more specialized supports or would only prefer to engage in that way. So you can appeal to many people at once. Yep, go ahead.
I do have a question about groups.
Yeah.
So during group sessions, are there other healthcare professionals, are there experts there that are helping with the activity you're doing with the group, or is it normally you doing all the facilitating?
Typically you'll have a co-facilitator, just to support the flow of the conversation as well, because and that's a great question, because sometimes like you can feel a lot of pressure, like how am I going to run this whole thing by myself? The reality is that you're presenting things to people and you're challenging them to open up and engage in discussion and activity, and so like you're only bringing some of it. And trust me, like when I was a student too, I was like, how am I going to command a group of people like this? How am I going to talk for an hour? Right? Like, I don't know how I'm going to do those things. Then you come and you put it into practice, some of the things that you learn, and you realize that you're only doing some of it. And the rest of it is for the individuals to kind of give you information, and then you work with that. And the more confident, like the confidence builds the more you do it. And trust me, it's okay if your first few groups are a little um, like choppy. It's okay. We're working in a service where it's for people, by people. We're not machines, and we recognize that sometimes we have to adapt to the environment then and there. And so we teach you things like group dynamic principles, manage a challenging group, for example. Like imagine being a comedian going on stage and no one's laughing at your jokes. What do you do? It's awkward, right? So in that same line, we teach you how to bring things back. And the co-facilitator is always great at supporting the flow. If no one else is talking or speaking or willing to contribute, at least you can have that back and forth. And at some point, someone might come in. And if you're not getting someone that's engaging, that's okay. I mean, you can only control what you control, right? And so the second part of that, because I can understand where the angst may come, is that you chart that, you reflect that you
All right, Jonathan, not sure if
may not
you're.
have an active participant for the development of that person, from someone that is not very engaging to maybe one of your more engaged consumers much later in time. Does that make sense? Excuse me? Okay.
Sorry, I thought like the screen froze for a sec.
Okay. So the recreation therapist has many hats. All right. And by many hats, I mean we do a lot of different things. And you can see from this, like this flow chart, we start as a therapist. We can also work as a facilitator, an educator, a resource, and advocate, up until the very end, where you see um, autonomy. This is where an individual may no longer need our support because we've supported them through all the different avenues where they may need support as a foundational practice. And afterwards, they're free. You know, go little bird, do your thing, enjoy your life. So we determine our role largely by the function of the individual. Um, and this is done again through assessments and evaluation. And it's always going to be a dynamic process. It's never just one at a time. Sometimes we go back, forward. The reality of working with people is that it is dynamic, especially within like a field like mental health or people that have cognitive challenges, because you never know where their wellness is at. So now you're wondering probably how, like there's recreation. What is therapeutic recreation? How do you make recreation therapeutic? Well, we enhance the leisure experience. We enhance the leisure experience through the facilitation of leisure skills and knowledge. That's our own doing. Oh, sorry, I caught a typo here. And I'll fix that later. And then we also facilitate leisure environments. So the facilitation of leisure skills and knowledge is we employ those enhancement strategies that we talked about, like the reinforcement of the leisure, and we also determine the individual's interests, preferences, talents, abilities, skills, competencies, their current leisure knowledge, and their aspirations, where they want to go. So all of those things have nothing to do with you and everything to do with the person. Imagine how you might feel coming to meet a recreation therapist. This person is so interested in you, your skills, your interests, your preferences, meaning the way you want to do things, your maybe perceived challenges, your competencies, and what you already know. You're going to feel very special. You're going to feel very supported. And this is what we're doing. We're trying to support a person in moving away from this kind of reserved way of sharing information about themselves to wanting to. And in the reality, recreation brings it a lot more than what you would have in a formal setting. People may be guarded, right? But even when you're just going for a walk, imagine when you're going for a walk with your friend, things just come out easier because you're doing things and conversation flows more naturally. Then we facilitate leisure environments, right? We support people by making sure that the leisure is authentic to themselves. We make sure that it matches their lifestyle rhythms, their current routines and schedules, is considering of the social supports that they may need in order to actually engage in those activities, and finding inclusive environments. Let's say you're in a wheelchair. Is the place accessible? Can you even get in there? So things like that, and also like connecting with administration and the people that are actually running these programs to know like what is the perception, is there accommodation, because that's also very important. So that's one way that we make therapeutic recreation therapeutic, to enhancing the leisure experience to ensure that it's relevant to the person, a reflection of their skills and abilities and desires, and that they can be accommodated in the places that they want to go. We also support in developing strengths. So when you can see here, we have the potential for developing psychological and emotional strengths, which is how we perceive and feel. Cognitive, which is the way we think and learn. Spiritual, which is also how we perceive and feel, and also feel the ability to relate and belong, which mimics social. And physical, where we act and do. So I'm not going to read all of these things out, but when you look at them, perceive and feel, all these things, for example, are the things underneath it that we can support a person in developing to become stronger, which is ultimately going to support them in being more able to engage in those activities. Think about it. Let's use psychological emotional strength as an example. Your capacity for happiness. That's a strength. right? If you can develop that, then you're opening yourself up to actually feel more happy than you do. And not everyone is able to do that right away. I'm sure maybe you've come across people that are very resistant to happiness. How do you overcome that? All right, stay tuned. Sign up for the course. I'll show you. Emotion regulation. A lot of people have challenges regulating their emotions. They may be inhibited, they may be disinhibited, they may not be very self-aware or autonomous. Maybe they haven't had opportunities to build up their capacity for confidence to do things on their own. These are all weaknesses that can be turned into strengths. So when we look at the 5 here and the multiple different things underneath each of these, you're going to change this person as long as you're open to it. And you show them what it is that you're going to support them in improving and reinforcing. Speaking of reinforcing, along with strength, we support in the development of resources. Those same things that are strengths require specific resources to allow them to be developed. Right? With psychological and emotional, you have things like behavioral supports, natural cues, having actual quiet public spaces, or positive attitudes and expectations. Environmental cues, environmental modifications, adaptations to the actual activities. These are all very important things, and they're very all-encompassing, and they're interdependent as well. If we look at social, for example, inclusivity and diversity is a huge aspect of what we do as recreation therapists, because we're looking to eliminate barriers. By eliminating barriers, challenging stigmas and old societal norms, we make way for new ones. And in 2021, we're as accommodating as can be, and we're only continuing to elaborate on that. We can advocate for an individual and teach them also how to advocate for themselves. There's a lot that we do here. So we're come to client outcomes. When a person is done working with us, we support them in achieving a sense of well-being. Look at the middle of the flower. It says, I experience a state of successful, satisfying, and productive engagement with my life. Someone may come to you and say, I just want to have increased well-being in my leisure. All right. Someone might come and say, I just want to have increased social well-being or increased physical well-being. Notice I'm just saying one. And we can say, that's great. And we can do that for them. But in that process, we can show them how diverse wellness really is and well-being really is, and ask them if they, for example, think in a focused way and learn eagerly. And if they don't, how we can support them in enhancing their cognitive well-being. Or if they feel that they're able to relate to others and belong to valued social groups. And if they don't, we reinforce that. So we're looking to support an individual in experiencing a flourishing life. And so that's why our model, aside from the leisure ability model, we're also going to be talking about the flourishing through leisure model, where the development of strengths and resources in all these facets of well-being are going to create a greater quality of life for the person. So I hope this has been intriguing for you. And I guess what I'm going to do now is just open it up to any specific questions that you may have.
I do have a few questions. I think there was one a few slides ago where you talked about, I think it was environmental cues, and these one, natural cues and environmental cues. What do you mean by cues exactly?
So environmental cues would be like, and it helps to have a specific example. So let's say like an individual with autism, all right? We know that an individual with autism often has challenges with social communication and interaction and express their emotions and feelings in the way that we expect, right? So environmental cues would be like maybe having like specific lighting in a room, having a snooze room available for an individual to be able to manage or mitigate a trigger. Just simple things like that. An environmental cue is like the physical environment around the individual that we make. So the modifications could be to the things that they engage in, the place where they engage, or the actual adaptation for the activity. So let's say like a person doesn't have like their arm, right? Or a hand. How do we support them in still like engaging, whether that's through prosthetics, adaptive movements as well, all those other things. We work to kind of like mitigate or enhance. If someone is in a wheelchair, we may have to get them a sports wheelchair. If someone doesn't have, let's say, the right tools to eat because they don't have fine and gross motor skills, they'll have a specialized fork, specialized spoon, things like that, right? And so we work with people that may be more versed in some of these things, like an occupational therapist, collaboratively, because we don't have all the answers, and come up with these interventions that are going to support a person to achieve those outcomes.
Okay, that makes
Does
sense.
that make
Yeah.
sense?
Yeah, thank you. I was like, what does he mean by cues?
Yeah,
I
it may just be semantics, like
okay.
yeah, yeah.
I do have a few other questions. I really like the flower at the end. That's really nice.
Mm.
Um, do you ever have clients that like push back at you, be like, I'm only here for my physical well-being. I don't care about the other ones. You have that
Of
happen
course,
often?
of
Yeah.
course, yeah. Like some
Okay.
people are just like, yeah, I only want this. Hey, if that's what you want, that's great. And we meet the person where they're at, right? Not where we want them to be. And that's
Mhm.
very important because we don't want to put too much expectation on the person in a way that's pressured and dampens their perception of what we do and what we're trying to do with them. Because we're trying to work with them, right? But I'll tell you something, Lindsay, honestly, more times than not, by the end of a full intervention, like from start to finish, after the outcomes are achieved, people start wanting more because they recognize that they're deserving of more.
Mhm. Oh, that's beautiful.
Yeah,
Deserving of more. Oh wow. Okay. Okay. And one more question. Sorry, I have a lot of
yeah,
questions.
no, this is exactly what this is for.
So I know, or maybe it's just my assumption, for to be a recreational therapist or any kind of physical therapist in a way, when you go to university, you need to have a strong science background. Like science is my weakest subject. That's why I've always kind of not done any of the healthcare sector jobs or anything like this, but I would love to. Do you have any
Mm,
kind of advice about
absolutely.
that?
It's actually a misconception. So I'm going to squash this right there for you, okay?
Okay.
With regards to like therapeutic recreation, it helps to be science minded, but it's more so just being like hungry for that understanding and knowledge. With regards to like the courses that you may have to take, right? Like when I was doing my bachelor's, I did a few courses in anatomy, a few courses in what was it, anatomy, um, physiology, but they're not relevant. It never comes up. Like they're intro courses anyways. And so, what am I supposed to do with an intro course? Just spit information at you. The more specialized topics teach you how. And so, that's for the people that are meant to do that. We don't want to work outside of our scope. We're working to enhance an individual through our social skills. If you have strong social skills, you'll be a great recreation therapist. If you're goal oriented, if looking to mitigate problems for a person, if you're working through that type of mindset, you're not going to have a challenge. Most people, they have a challenge connecting with an individual, right? So like it's the interpersonal skills, it's your therapeutic skills that are really going to make you a good recreation therapist. um like some of these like science courses, like just try to get through them, you know what I mean? And that's the best advice I can give you if that's what's required of your program. If your program doesn't require that, that's even better. But I don't want you to feel that if you're not like so strong in your sciences, that this is not the appropriate field for you, because once you come into practice, none of that is relevant. Depending on the stream that you work with, or let's say you're working in mental health, you may hear a lot of medications. Just Google them, learn what they do, right? But like, you're not the one prescribing the medication. You just may need to know that like someone is being medicated for their psychotic delusions, and that medication may make them dizzy. So you want to know like, when do they get the medication? How long does the dizziness last for? So you're not taking them dancing. Do you know what I mean?
Yeah.
Yeah. So that's what I would have to say to that. Please don't let that be a barrier for you, because it's not a real representation of what the profession requires.
Awesome. Thank you.
Yeah, of course.
Awesome. like Lindsay, if you don't have any questions, I'm gonna ask some frequently asked questions as well for myself.
Sure.
Okay. So I guess this is kind of like oddly specific. You mentioned that you work for a senior center as well,
Yeah.
and I was just wondering, like, how do recreational therapists use technologies or emergent technologies such as virtual reality for their clients? Has technology been possible to use for or by elderly people or elderly clients?
That's a great question, actually. I mean, recreation therapy, actually, any service has evolved over the past 2 years because of COVID. And we've just added this other way of presenting our information and way of engagement through platforms like Zoom, WebEx, and like other things like Oculus and this and like for the virtual reality piece. But like all of our programs have had to make a little bit of a switch to the virtual side. It is definitely harder for seniors depending on their capacity. Some seniors are able to navigate independently, and that's great. Give them that autonomy. But in group settings, for example, we'll have like multiple tablets and we distribute them. And so, depending on the level of support that an individual has, they may have their own support worker. You may be demonstrating, and people may be going along that way, or you can project your own like virtual, and then like you can do their input for them. So there's lots of ways to engage, and it was challenging at first because we didn't know how in the first year. But as an organization, there's Therapeutic Recreation Ontario, where I live in Ontario, but there's also the CTRA, the Canadian Recreation Therapy Association, and we're in communication all the time about how we can enhance our service delivery and mitigate some of these challenges. Because the reality is that we do a large concentration of rec therapists work with seniors. Um, and so, how can you go into this field and be successful or not lose your motivation to work when, let's say, you were trained in person facilitation and now have to, uh, adapt to virtual? Um, Really, the thing is that just knowing that like not everyone's going to be able to engage on the same way, not to put that expectation on them, and you do that preemptively in your program design, where if the majority of your clients or the people that you're working with need specialized support, you wouldn't give them too much uh, uh, like autonomy with regards to having to input their own information. You would be the one to facilitate that out, and you can put that on the screen or like however you do it. And I'm speaking very generally, like with specific examples, it makes it a lot easier. So let me give you a specific example, um, like Jeopardy, right? Jeopardy, we can make it virtual because it's. We also don't want to like have unnecessary amount of contact with an individual. So if you're running these types of groups, you could like set up a tablet for the person, have the mic on for them. You're in a different room or outside their room, and you're just like this. You're presenting the screen, and you're hearing their answers, and you're engaging that way. So there's lots of different ways to do it. Jeopardy is just one example. You can do with bingo. You can do with exercise. Um, but the thing is, we are a bit more limited in the ways that we can do that. So it just requires a very creative mind. That's why it's so important to also know how to connect with your professional body, because it shouldn't just be on you, right? Once you graduate, get your education, welcome to the world of therapeutic recreation. You're a recreation therapist, so you should be using your resources. And we teach you all of this in the course, right? We teach you how to connect, how to like um, collaborate, and all these things, so that you're able to further enhance your service delivery and not feel limited in your reach.
That's good. Thank you. I guess this is my last question.
Yeah.
So when you're designing a program, or specifically for seniors, let's say you're designing a program for the a long-term healthcare home. I
Okay.
mean, like who has like a moderate capacity and mobility. How long is a typical program? Is it kind of like does it work kind of like a class wherein it's semestral or something like that?
That's a great question. Like with seniors, it like again, it depends on the capacity. But if you're saying moderate, right? Like if you're saying like people are like still able to engage and all that type of stuff. Is
Yes.
that right, Rika?
Yeah.
Okay. Well, then you also have like, there's a few caveats here. You need to know your population, not just in terms of like the demographic, but who the actual people are on the unit, right? So like, let's say you have a 20 bed inpatient senior unit. Knowing those 20 people, maybe they all have short attention spans. Why are you trying to, beat a dead horse by doing an hour-long group? So you would consider that and maybe say like 20-minute group or 30-minute group, or like, it doesn't have to be like 30 minutes. It doesn't have to be an hour. We're looking at meaningful therapeutic engagement. If you can give someone that, like what it is that you're trying to give them, like the outcome of the group, depending on what the domain is that you're targeting, then if it's short and sweet, that's great. If they want more, then they'll let you know, and then you can do more then, right? Rather than try to stretch it out the first time and then just feel kind of awkward. It really depends. But I'll tell you this, I run 15-minute mindfulness groups. I run 20-minute exercise groups, 30-minute walking groups, and hour-long discussion groups. It really depends on the group itself, like what it is that you're presenting or what it is that you're facilitating, and also the level of engagement. Sometimes you may only mean to run a group for 15 minutes, but people are loving it and request you to go longer. So that's a good indicator of like the evaluation process when you go back to designing the program and implementing it, how you can do that.
Awesome. So yeah, it further reiterates that it is very user-centric or client-centric at this point. Yeah.
The great thing is that because nobody really like understands recreation therapy, we're the ones going and educating them, whether it's the clients or the interprofessional team. No one can tell you how to do your job other than you, right? So you can have 3 20-minute groups in a day, but remember that like in a workday that's 8 hours long, you got to run the group. You may have to transport the patients there and back. You may have to chart on each and every one of them. Those things take time as well. So, and you may even have to debrief with individuals that like maybe had some sort of, maybe they had an altercation in the group or something like that. So you really need to consider all of those things. There's so many things to consider. So remember, we talked about like quantitative and qualitative service. And so we're not just trying to run a numbers game of doing the most programs possible. And some administrators may expect that of you. I want you to run one group every hour for like the whole day. They don't understand what it is that you do. You have to explain to them, I do a lot more than just facilitate groups. I have to have, that connection with the individual. I have to chart on that. I have to make sure that it's a qualitative service, that they get meaningful therapeutic engagement from it, not just being shuttled from one thing to the other, like kindergarten kids, right? At the end of the day, these are adults. We want to treat them with respect. We want to treat them in a way that's mindful of, their capacity. So all of these things are things that we consider when designing the group.
Amazing. Thank you. So yeah, that's all for my questions. Yeah, I guess if we don't have anything in the chat box or in the Q&A box, so yeah, I guess we can wrap up at this point.
Great. Well, Lindsay, so glad that you came and, really appreciate all your questions. I hope that this was a good session for you and that you enjoyed it.
I did. Thank you.
Good. You're very welcome. And, any other questions, you can always reach out to me. My Ashton College email is available, I believe, on the website, or we can maybe able to also send them along. Yeah. And Rika, thank you for hosting and making this happen.